All right, welcome everybody to the Functional Medicine Show with Dr. Lauren Castle from the Functional Medicine Pharmacist Alliance. So she's got a big update from her previous event that she just went to. I'm going to let her speak to that in 1 minute after this reel. Lauren was just asking me how to play the reel, and don't double click it because then it disappears. All right, Lauren, where did you just come back from?
Oh man, I just got back from Orlando, Florida. We were at the American Academy of Anti-Aging Medicine. Actually, have our little official partnership page here. So this is our third year as an association partner for A4M with FMPHA, and they are one of the main two partners that we have. So Institute for Functional Medicine is one organization, obviously, as the name implies, focused on functional medicine. A4M is focused in more of the anti-aging space, which we've kind of talked a little bit about on some of the previous episodes. So go back and check those out if you haven't seen them. But this particular weekend was the A4M Spring Congress down in Florida, and the topic was all about inflammation. So it was actually just a really cool conference in the way that they set up the sessions, because they sort of had this one central topic of inflammation. You kind of might think like, well, how many different ways can we talk about inflammation? The answer is like hundreds. So they approached it from, again, a truly functional medicine approach, right? Which is, how can one physiological driver in the body, such as inflammation, manifest as all of these different chronic disease states that we see: heart disease, diabetes, environmental toxicities, mental health, just all of these different problems that we're all dealing with and seeing in ourselves or our patients, and really focusing on, again, kind of the flip side. Okay, so if we know it causes all of these things, then how do we treat it? And what are all the different ways that we can treat and quell that inflammation happening inside the body, whether it's nutrition, food, exercise, no exercise, sleep, stress management, supplements, hyperbaric oxygen therapy, all kinds of different modalities and practices and tools that we can leverage to treat at that root cause level. So just like a really beautiful way of like the functional medicine tree that we think about, in terms of all these different symptoms, all these different disease states, and then really how they all come together, but then all the different ways we can treat it. So just a really, really cool conference in that way. The flip side of that, though, too, is these in-person conferences are just such an incredible opportunity to meet people. So yes, we spent some time in lectures, learning, in the expo hall, networking, learning about new products and services and tools and technology that can make it easier and more efficient to help patients better and faster. But you really can't beat the connections there. So we were super excited that A4M gifted us 6 tickets to actually bring in some of our FMPHA members to this conference. Sean is coming to the one in December. He's already so excited for it, right? It really is just like, it'd be right up your alley. And for so many other people that are watching right now, if you're like, oh man, that sounds awesome, it is. You just can't beat these in-person events and getting to network and get to know each other and build those relationships and friendships now. I mean, this, again, it's a third year in a row. And so some of these people I've really gotten to know over the years, and it's just incredible to see all the things that people are doing to move healthcare forward.
I love it. I agree on the in-person events, right? That's like there was we were robbed of that for a couple of years. There was 10 years where I never even thought about going to an event, and I missed out, right? That's where you build those true connections. So that's great that you went there. I just loved the inflammation piece. I know we talked about that previously, but it's just like having, like you said, how many different ways can you talk about it? Hundreds.
Mm-hmm.
which is like, okay, where do we start?
Yeah.
And that's just kind of like, for me, with what I want to do, and I've told you about a wellness center that I want to launch here soon. It's like, it's like, where does a person get started, right? Well, obviously, like, I'm gonna say, go talk to Dr. Lauren Castle, right? Get started there first, right? Especially for RPHI, because we have a good program for her there.
Yeah.
But it's still like, just to kind of compound on that, it's like, when you submerge yourself into that, you can get to clarity much faster
Mm-hmm.
than just wondering and continuously wondering.
Yeah.
Yeah.
Yeah, absolutely. And I think that's actually a great question to ask because it applies in different ways as well. Like, where do you start as a clinician or a pharmacist who's just beginning their functional medicine journey in terms of the business and how you practice? Like, how do you start there? And then once you have that set up, then how do you actually start with your clients and your patients in terms of actually working up someone's case and kind of looking at this clinical picture and being like, holy smokes, like, whatever, everything's on fire from a clinical perspective. Where do you start? Right. And that's part of the journey. And that's what's so great about just continuing to come to conferences and learn truly the most up-to-date information, right? Because yes, they try to keep the certification programs and things like that, updated, but really the whole purpose of having these in-person events and these annual meetings is to bring forward like the most recent data and studies and research that's being done on these different topics. And I think it's so relevant. There was tons of talks on things like long COVID and the effect that has had, right? So it's like, it's so timely and relevant, and just a really great way to learn some of that new information that you can take right back and put into practice with patients and clients or family and friends or yourself, right? For a lot of us that are on that journey of our own health as we're supporting others on the journey as well.
That's awesome. I'm very intrigued. If we could pick out one topic just to talk about, like, for 1 or 2 minutes from the hundreds of topics you heard about when you were there. My rabbit ears went up when you said mental health. And, I picture mental health and kind of stress related and inflammation. What did you bring back from that you could give us a little soundbite or teaser on from that track, if you went to that track?
Yeah. So, in terms of mental health, there's just so much research being done. And in some ways, it's like what's old is new. And it's really returning to our roots and simplifying things. Because oftentimes we think about like, oh, what's the best new treatment, and things like that. And certainly these things can bring more rapid relief, but at the same time, you also have to be working on really just the simple foundational things. I went to a talk that Dr. Jill Carnahan did. I think that was probably my favorite talk of the weekend. And hers it wasn't necessarily just focused on mental health, but it was focused on environmental toxicity. And like, that's a term that I think, kind of gets talked about a lot. But when you really think about it, she summed it up in focus on clean air, clean water, and clean food, because those three things are like the vital things our body needs every day to function. And so often those basic things that we have to bring into our body are contaminated or toxic or have things that are going to be driving inflammation in the body. And that can manifest in all these different ways, right? So air pollution, I'm actually reading the book called Breathe by James Nestor. I know for whatever reason, I think a lot of people have discovered that book recently. It just talks about like how important our breathing is. And if we don't have good air quality where we live, that can cause inflammation in and of itself, right? So whether that's just opening a window in your house, on a nice spring day to get some fresh air in, if it's using non-toxic products or bedding or carpet or paint, or any of those things, it could be looking like air purifier depending on where you live. From a water perspective, water always comes back. I feel like for me, because I started my journey in Flint, Michigan, right? Like that was part of where I first became interested in this functional medicine approach and seeing patients with lead toxicity from the water, right? So it's like, do you have a way to have clean, filtered water, that doesn't have these potential contaminants in it? That again, you might think that it's safe, but sometimes you'd be surprised that that little bit can add up over time. And then obviously with food, we know food is so important. And, at the end of the day, there's all kinds of different diets and you can customize things for individual patients based on what they need in terms of calories and micronutrients and all those things. But regardless of what the food is that you're eating, it needs to be clean in terms of organic if possible, grass fed versus something that's just coming from a feedlot, potentially having glyphosate sprayed, grains and things like that. There's just so much in terms of the quality of the food that really does make a big difference in the outcome of the interventions that we're going to recommend. So it's really starting with some of the basics, and that can be immensely powerful for patients.
I love that. No, and all that rings true. We have a comment here about air quality, and I was thinking about that too, because I mean, I used to live in LA. I live in San Diego now, closer to the coast, where it's like we have the breeze off the ocean, so it's not that bad. But I remember living in LA, and I was like, okay, like there's no way around that. So big. Okay, so that was sidetracked. Thank you for the comment. I'm gonna throw a scenario at you right here, Lauren. This is off the cuff because every time I go back home to visit my family, I grew up on a farm. Nobody understands why we stop at Whole Foods in the Twin Cities before we drive 2.5 hours west to get to my farm or my parents' farm, because at the small town grocery store in the town I grew up in, there's literally zero chance I can get any type of organic food, grass-fed, nothing, anything like that, right?
Yeah.
How do you work with people like that who may be in these areas that don't have a lot of either education on, those pesticides you're putting on your fields are bad, and the food that you're buying that are grown with pesticides are not good for you?
Mm-hmm.
How do you tackle those as a functional medicine practitioner?
Yeah, so there's a couple different ways to really start, right? One, you have to meet people where they are, right? And that can look like both geographically in terms of access to better quality food, as well as financially. And can they even afford the better quality food if they do have access? So with those two things in mind, there's kind of two places I start. One is with the idea that, the dirty dozen, the clean 15, if and where you can utilize those as guidelines, start there, right? Even if you can't afford everything organic, think about the things that are most likely to potentially have those pesticides that can be causing problems. And then if you really truly can't afford the organic things, it's as simple as just washing the food is going to remove a considerable amount of the residues, right? And I mean, let's be honest, sometimes it's easier to just like throw it in and start cooking, or just grab some berries right out of the box and eat them, and that's, I think, part of the disconnect for our brain is just like, oh, what's the big deal? Like, we have bodies, they can filter toxins, they can kill off bacteria or bugs or whatever. Our bodies were not necessarily designed to eliminate glyphosate and these like forever chemicals that our society has created today. So it really does make a huge difference in terms of protecting our gut microbiome and protecting our gut barrier. So those are the things that get impacted by these different chemicals whenever we ingest them, especially in larger quantities. So anything you can do to decrease that overall toxic burden truly makes a difference. And this is like, again, lifelong thing, right? It's something that you have to just be mindful of and create those habits and work towards. In terms of meats and things like that, again, you do the best with what you have. Generally speaking, for most people, again, there's always exceptions in either way. If you focus on eating a more Mediterranean style, balanced type of diet, half your plate being fruits and veggies and things like that, right? You can control some of that toxicity there from those types of foods. And then, okay, if you can get better quality meats, go for it where you can. If you can't, all right, well, let's just do the best with what we have and know that the fruits and the veggies and all of those things are helping to offset some of those potential downsides that we might have from the types of meat that we're eating that might be slightly more inflammatory based on the constitution of that animal's diet, but can we offset it? Same thing goes with like the cooking techniques that we use, right? If we're able to steam things or use more moist cooking methods, that's going to also keep the food a little bit more intact and decrease some of those more harmful types of reactions that can happen when you're grilling or heavily sauteing things, with a lot of inflammatory oils. So there's so much room in that spectrum for people to be able to just make slightly better choices where they're able to that truly compound over time.
That's awesome. Well, thank you. That was a great answer. And more of that, like if you're a pharmacist trying, like if this resonates with you, pill for nail stuff, you're kind of tired of that business, connect with Lauren, an RPH ally, and she will get you started on this path down the functional medicine program where you can use all that clinical knowledge in a better way. So Lauren, anything else before you want to let the viewers go?
Definitely join the channel. Another exciting update from the weekend, really again around networking and working with some incredible pharmacists that have been in this space for a long time. People like Sahar Sweden, who's part of the faculty at A4M. There was a lot of discussion around the future of pharmacists in functional medicine and just how these organizations are starting to recognize the value and the need to bring more of us in to support all of these patients. And so I really think this year is going to be huge for pharmacists in functional medicine. And these bigger organizations are starting to see that. They're starting to recognize it. So there's truly no better time to join and be part of FMPHA than right now. We're going to have some really exciting things coming down the pipeline in terms of membership benefits, training, updated versions of the boot camp, so much stuff. So I'll actually be talking a little bit more about that tonight in the Facebook group. I'm going to go live twice in one day, like holy smokes. But yeah, Christina Fontana and I are going to be going live tonight at 7:00 Eastern time. So if you're around, join us for that. You can obviously watch the replay as well, but we'll dig a little bit more into the future of FMPHA on that episode tonight. And yeah, exciting times. So definitely stay tuned, be part of the channel, and we'll keep you updated.
Awesome, Lauren. It sounds great. Good luck tonight. You're always great.